My Lords, we are still waiting for Minister Merron to arrive to answer the first question, which I'm very, very sorry about. But I mean, obviously, of course, I did tell people about the fact there's no prayers on, so I'm somewhat embarrassed to be standing here telling the House that we're going to have to wait a few moments for Baroness Merron to arrive. And I'll be... Well, yes, well, you know, thankfully I've got absolutely no information here. So I'm going to keep talking on the basis that at some point Baroness Merron will arrive in the House and be able to answer the questions before us.
Can I help?
Resign, yeah. Filibustering, absolutely, yes. I've been...
Can I just express my gratitude to the Chief Whip for reminding me that there were no prayers?
And Baroness Merron is now here.
First oral question, Lord Alton of Liverpool. I beg leave to ask the question standing in my name on the order paper.
I apologise to your Lordship's House, and I'm grateful to the Chief Whip, my noble friend, as ever. My Lords, in 2023 to 24, 8.7 million identified patients were prescribed antidepressants at a cost of £220 million. This compares to 2015-16, when it was £270 million for 6.88 million people. The NHS Business Services Authority report patient prescribing data on an annual basis rather than a running total. All licensed antidepressants meet robust standards of safety, quality and efficacy, constantly reviewed by the MHRA.
My Lords, can I thank the noble Baroness Lady Merron both for her reply now, but also for facilitating and attending our meeting with the Medicine and Healthcare Regulatory Authority. Has the noble Baroness had the chance to read the correspondence which I've shared with her from the bereaved family of Thomas Kingston, who, like Olivia Russell, committed suicide while using antidepressants, and has she noted that the coroner intends to issue a prevention of future death reports to the MHRA? In the light of this and this tragedy, what can the Minister do to create a more rigorous approval regime, including greater definition of risk? And given that hundreds of millions of these drugs are issued at a cost of hundreds of millions of pounds, can the government establish a longer-term inquiry to ask searching questions about root causes, what's leading to endless repeat prescriptions and driving such widespread reliance on antidepressants?
Let me start by extending my deepest sympathies to the family of Thomas Kingston in the light of his very tragic death earlier this year, and we will await the findings of the inquest and act on any recommendations by the coroner as appropriate. Whilst there has been an increase in prescribing, as the noble Lord observes, I would make the point that antidepressants, for example, are often prescribed for a wide range of reasons, not just for the treatment of depression, but also for migraine, chronic pain and ME, amongst others. So there is a very wide range, and the other reasons that it could have increased is because there is less stigma, I'm pleased to say, in respect of seeking mental health treatment. But I would say to the noble Lord, it is never the first port of call. It is one of the tools in the box to assist people. There are no current plans to conduct a review as he requests.
My Lords, noble Lord Alton did not mention whether we are talking about specific antidepressants, but I think the case he referred to does refer to a group of antidepressants called selective serotonin reactivation inhibitors that treat the patient by increasing serotonin levels. But they do run a risk of patients having suicidal ideation, a feeling of wanting to commit suicide. In the meta-analysis carried out using 29 reports of research, it was found that they're beneficial in early phase of treatment of depression. But in later phases, the data is less reliable. Hence, the question is whether MHRA and NIHR working together look at the evidence that is available and produce the appropriate guidance, because one of the important things to avoid higher risk of suicide using this group of drug is to have a proper monitoring, which means proper controlled visits to appropriate health specialists.
Well, I can assure the Noble Lord that NICE does keep all its clinical guidance under active surveillance to ensure it can respond to any new evidence that's relevant, including relevant clinically related literature that could possibly impact on its recommendations. And more broadly, I'd say to the Noble Lord that guidance does recommend that suicidal ideation should be monitored in people with depression receiving treatment, and particularly in the early weeks of treatment, and that does include specific recommendations on medication for people at risk of suicide.
My Lords, my Lords, a study in My Lords, a study in 2019 found that a third of women were prescribed antidepressants by their GP to combat symptoms of the menopause. What is the government's current assessment of this situation and adherence to NICE guidance in this area? And if the Minister doesn't have full details to hand, perhaps she could write to me.
I would be very pleased to write further to the Noble Lady. It is a very important point about support for women in the menopause. However, what I would say to the Noble Lady is that prescription is only made after discussion with the patient as well as other alternatives, and the clinician has to be following the guidelines in order to comply, and I would also say patient choice is absolutely key here. So it is a case of every individual is an individual, and what is appropriate should be prescribed if needed.
The Minister has pointed out, SSRIs can be the right choice for some patients, but in order for there to be patient choice, there has to be capacity for those therapeutic options. But in April 2024, around 1 million people were recorded as waiting for mental health services, 340,000 were children, and over 100,000 had waited for more than a year. The government has pledged to provide an additional 8,500 mental health staff. Can the Minister say what she will do to increase patient choice and build that capacity?
We have already made a number of commitments, but the Noble Lady is quite right to observe the excessive numbers on the waiting list, and we are deeply aware of the distress and continuing difficulty that causes for many. Lord Darcy, in his independent investigation, confirmed that about 1 million people are waiting for mental health support as of April 2024. And as we move to the 10-year plan, that will be a whole opportunity to put mental health services in a different place. In addition to the commitments that the Noble Lady has mentioned, we are also providing access to a specialist mental health professional in every school, and providing open access young future hubs.
My Lords, I am grateful to the Noble Lord Alton for organising a meeting recently with the Noble Lady, the Minister, the MHRA and some psychiatrists who raised the issue of SSRIs and the side effects. Now, one of the concerns raised was that patients need to be aware that one side effect of SSRIs is to have suicidal thoughts. So I was surprised to look at the NHS website and its page on side effects of antidepressants that you have to scroll down 4 or 5 pages before you see the warning signs about suicidal thoughts. So while we await the review from the MHRA, which they discuss with us, can the government and the NHS look at the advice on the NHS website so that those who prescribe SSRIs are clearer about the risk of suicidal thoughts?
Yes, indeed, I'll be happy to look at that. However, it is the case that there have been warnings on the leaflets within medication for some 20 years. It's always a cause to review to make sure it's more effective. And I'd say there's at least 2 sides to this. One is the clinician doing their job to discuss side effects, including at withdrawal from the medication, but it's also important that patients understand it as well.
Is my noble friend the Minister aware of the work of the Charlie Wadder Memorial Trust, who's directed to provide awareness among teachers, tutors and so forth of the danger of suicide and the work that they perform?
I'm not specifically aware of the point that my noble friend raises, but I'll be glad to look into it.
My Lords, I want to raise the issue of dependency on antidepressants. As the noble lady, the Minister, will know, there's an awful lot of people who have great difficulty coming off these antidepressants. And it is striking that for those using drugs illegally or substance abuse, that there are many services. There are no services in the NHS for those seeking to withdraw from antidepressants, and this is a major problem. So with that in mind, can I ask two questions? Firstly, will the government give consideration to the delivery of a helpline, which has been called for in a number of reviews on this, so that people can have some access to help? And secondly, will they support an NHS project which is designed to introduce withdrawal services within the NHS?
It is an important point that the noble lord makes about the effects of withdrawal from any medication, indeed. I'm not sure this is an exact answer, but there is, of course, the 111 helpline, which has been expanded to refer to mental health services, so people can ring and ask those questions. But I do take his point about withdrawal, and I would, that may be something that we would wish to consider as we go towards the 10-year plan.
Second oral question, Lord Addington. My Lords, I beg leave to ask the question standing in my name in the order paper and remind the House of my declared interests.
My Lords, the majority of children and young people with special educational needs have their needs met in mainstream schools, and we're committed to ensuring that schools have the resources and expertise to identify needs earlier and support all pupils to succeed. We're working with experts, parents and carers to strengthen accountability and ensure inclusivity through reforms to Ofsted inspection frameworks, increasing workforce expertise through evidence-based training and encouraging schools to set up resourced provision or SEN units to increase capacity to better support children and young people in mainstream settings.
I thank the Minister for that answer, but remind her that it is estimated that 70% of dyslexics are not identified at school. The figure is also very high for things like those with high-functioning autism. Is the government going to make sure there is a coherent pattern of training so ordinary teachers refer to those with expertise to identify? Because if you don't identify, you stand no chance of giving the different learning patterns that are required.
The noble lord is absolutely right about the need to identify early, and we do have measures in place to help teachers with early identification and support, and particularly for the teaching of reading, including the phonics screening check and statutory assessments in Key Stage 1 and 2, the English Hubs programme, the reading framework, an updated list of high-quality phonics programmes for schools, training for up to 7,000 early years special educational needs coordinators, and the Partnerships for Inclusion of Neurodiversity in Schools programme, which will upskill primary schools to support neurodiverse children.
I am the great aunt of Ollie. He's I suppose my great nephew, and he at the state school, brilliant, Liberty at Merton, can't speak highly enough of them, and they had no trouble identifying he had a problem. The problem was the assessment and the length of time waiting for that. So in the end, I coughed up and paid for it, and he's now in a state school with a treetops with a special unit, and he's cooking and he's thriving. I had my first birthday card that I could read every word this year. So can I ask the noble Baroness, the Minister, how many children are waiting for assessments? What's the reason for the long waits? And what are we going to do about it?
Ollie is very lucky to have the Noble Lady as his great aunt, and but she raises an important point about the speed with which it is possible to carry out assessments, and it's for that reason that we are supporting local authority educational psychology services by investing over £20 million to train 400 more educational psychologists, because they play a particularly important role in supporting local authority educational psychology services and contributing to statutory assessments. And we must, as the Noble Lady says, ensure that more children are able to succeed in our mainstream schools, as I'm sure Ollie will.
My Lords, 1 in 20 people in the UK are estimated to have dyscalculia, yet it frequently goes undiagnosed and then therefore without the support that would enable these young people to overcome the challenges in processing and dealing with numbers. Currently, there's no requirement for maths teachers to learn about dyscalculia, and even special needs teachers aren't always trained to recognise and deal with it. So will government consider introducing a statutory requirement for maths teachers to learn about dyscalculia in initial teacher training? And can she confirm that these specific challenges will be addressed through the curriculum and assessment review?
Well, the Noble Lady does make an important point about the responsibility of all teachers to be able to identify special educational needs. All teachers are special educational needs teachers, and that's why, whilst I cannot be completely clear about the point about dyscalculia, I can assure the Noble Lady that we are supporting improved teacher training through teachers' careers, starting with initial changes to initial teacher training coming in from September 2025, and then going through teachers' careers as early career teachers and then into their leadership roles. But I will perhaps follow up the particular point that she makes in her question.
As my honourable friend the Minister knows, there are hundreds of thousands of children who simply do not go to school. How do we measure the limitations that they're facing in the educational sphere?
My noble friend is right, either through persistent absenteeism, where we do, for example, see a higher proportion of students with special educational needs, or those who have been completely removed from schools and are no longer on school registers. So it's important both that we tackle absenteeism in the way in which this government has outlined, and I've talked about on previous occasions at this dispatch box, and also that we introduce, as we intend to do through legislation, the registers for those children who are not in school, so that we can ensure that they, well, first of all, that we can make our schools appropriately inclusive, so that parents don't feel the need to remove their children, and children don't absent themselves from schools because of their inability to be able to learn, but so that we can also track children when they aren't in school.
My Lords, despite significant progress in the identification of pupils with SEND in recent years, some groups remain significantly underrepresented in accessing a formal diagnosis and acquiring an EHCP. Looked after children, as well as those experiencing the most severe poverty, and those who belong to Romani Gypsy, Traveller and Roma communities, face particularly serious barriers. May I ask the Noble Baroness, the Minister, what steps the government will take to ensure that the most vulnerable children with SEND are better served?
The Right Reverend Prelate is exactly right, that where you see a assessment of special educational needs alongside other areas of disadvantage, there is, if you like, an additional concern and an additional difficulty for those children to succeed. And that's why we need to make our schools more inclusive. We need to make sure that we have the specialist workforce in place, some of which I've talked about today. We need to make sure that the investment is available for those higher needs in local authorities. And we need to make sure that we are intervening earlier. And for example, as more children are able to get early years education alongside the trained support that we are providing in early years education, I hope to be able that we will be able to identify those children earlier and start them off at least on a better chance of succeeding in our schools.
My Lords, last week ministers and the Department for Education rightly noted on social media the very poor results for children with special educational needs in the recent SATs tests at the end of primary school. But in the same week, there was a spooky silence from the department and its ministers when the analysis of the 2023 trends in international maths and science were published. My Lords, our Year 9 students are now 5th in the world in maths and 6th in science, beaten only by the East Asian countries. There was no word that I could find of acknowledgement to celebrate the success of English students from a single minister in the department on social media. So I wonder if I could invite the minister to take this opportunity to congratulate our students, thank our teachers and acknowledge that the Conservative education reforms had a massive impact.
I was around in 1999 when the focus of the last Labour government was on literacy and numeracy in a way which has undoubtedly led to continued improvements in our children's literacy and numeracy, and I am more than happy to thank and give credit to the teachers and the students who have performed so well in English and Maths international assessments. But a level of complacency, which I'm sure I couldn't accuse the noble lady of, but it is not right for us to feel that our job is done when we have a special educational needs and disability system which has been widely described by the NAO and others, including members of the Noble Ladies Party, as a lose-lose situation for our children and a failure to enable all children to be able to benefit from the excellent teaching that I am more than happy to praise.
Third oral question, Lord Rooker.
I beg leave to ask the question standing in my name on the order paper.
My Lords, I'm delighted to be able to say that a month ago this government laid legislation to introduce the mandatory fortification of non-wholemeal wheat flour with folic acid. We are the first European country to do so, providing protection for pregnant women and for their unborn babies from neural tube defects and the devastating impact on families. I pay great tribute to my noble friend and many others in this House who have championed this momentous intervention over a number of years.
I thank my noble friend for the answer. Would she formally thank the opposition? They spent 6 years saying no and 5 years organising the consultations that have led to this decision. And I recently, a few minutes ago, was looking at 4 ministers who had answered questions. Can I just ask a final question, though? And I don't want to be too negative about this, but why was it in the department's extensive press release on the day they published the regulations, there wasn't a single reference, even in footnotes, to the Medical Research Council's work of 1991, which, of course, over 80 countries have already followed. And my question would be, has the Secretary of State picked up the phone to talk to Nicholas Wald, who was, of course, the research scientist who led that work in 1991 that's been followed by so many countries and now belatedly, but welcomely, followed by his own country, the United Kingdom?
I'm glad my noble friend welcomes the announcement. that I'm making today. With respect to any phone calls made by the Secretary of State, I will gladly find out. I certainly can't comment at this dispatch box. And to previous ministers and officials over the years who have contributed to where we are, I thank them. In respect of the delay, all I can say is I'm very glad to be the minister announcing it today.
My Lords, and I also welcome Lord Rooker's tenacity. I think you've done an amazing job. So well done. I think for me, the issue is that, of course, it's really important to have widespread strategy to include folic acid in flour. And I just want to say to the noble lady, the minister, that looking at previous programmes, in order to reduce, let's say, rickets, to ensure that we don't increase inequalities by not thinking about the outcomes and ensuring that folic acid is also included in chapati flour, for instance.
Well, the addition of folic acid is to non-wholemeal products. Not just flour that's used in baking, but of course flour is in all sorts of other products, which is part of the reason for it being a 24-month transition, and of course industry can act quicker than that. But the reason that it's in non-wholemeal is because wholemeal is already a higher source of folate. So in respect of chapatis as a product, then all products will be considered. I should also add that some of the time on the transition is because of the labelling changes that are going to be required. So we're not stopping industry acting quicker, but we are being realistic about how long it will take.
My Lords, I'd like to congratulate the government on introducing this legislation and congratulate the noble Lord Rooker for his tenacity. However, I'd like to ask about another vitamin D. We know that 1 in 5 people in the country, between 1 in 5 and 1 in 6 people in the country, have low vitamin D levels, and that the previous government had a consultation on this back in 2022. And I would like to ask the noble Baroness, the Minister, to update us on what the government's policies will be to try and address the issue of low vitamin D levels.
I will be glad to look into that and to be able to update the noble Lord and your Lordship's House on the matter.
Also congratulate Lord Rooker on his persistence. These benches have always supported him. My Lords, I also, of course, welcome that more NTDs will be prevented. But given that we have to wait another 2 years, and given that the government's guidance for women who wish to become pregnant and who are pregnant to continue taking folic acid supplements, is the government looking at any creative ways of making it easier for them to do that, since we have to wait yet another 2 years? For example, having them available free in antenatal clinics or at family hubs, or some other creative mechanism?
As I mentioned to the noble lady earlier, whilst 24 months is a realistic transition, not everything will wait that long. It is the case, as the noble lady says, that there is still advice to those women who could become pregnant to take folic acid supplements, and it's very important we keep that message going. However, what I would say is, of course, 50% of pregnancies are not planned, and so it is not possible to prepare by taking those supplements, but indeed we're looking at all ways of effectively getting the message across.
My Lord, can I also congratulate the government on publishing the regulation, but also pay my tribute to the noble Lord Rooker for his tenacity. He may not welcome this, but I want to pay him tribute on this particular issue. My Lord, one of the frustrations when I was a minister on this was how long it took and the processes and the consultations. I just wonder, for future reference, if there are to be other supplements introduced into our food, has the department looked at particular ways that it could possibly shorten the process without compromising patient safety?
Well, patient safety is, of course, at the front of this, and I don't want to look backwards, but I would just gently suggest there are all sorts of reasons for delays. But we are where we are now, and what is important is moving ahead, and also the fact that we're working very closely with the chief medical officers across the UK. We are very much in lockstep with the devolved governments, and that I think will also assist.
Given the government's really excellent initiative to reduce the serious risk of neurotube defects, which causes such despair to so many people, would the government now tell us where we've got to with fluoride addition to the water supply to prevent dental disease?
Excellent. Well, my noble friend is quite right, because the policy we anticipate will reduce the number of neural tube defects in pregnancy by around 200 a year. And these are life-changing brain and spinal defects, such as spina bifida. With regard to fluoridation, that is a little wider than I'd anticipated. I must be... no, please don't apologise. I must say that we are seeing through all of the measures that are possible to reduce dental decay as part of our prevention, and that includes introducing supervised toothbrushing for young children. On the matter of fluoridation, I'll be very glad, because I know there are a number of Lords who are interested in this matter. They raised it with me on discussions to do with dentistry, that I'll be pleased to write to my noble friend.
My Lords, the noble Lord Rooker is quite right in mentioning Nick Ward, who pioneered the study which I was part of as a steering committee of MRC. The important point I want to make is that it is the early, before pregnancy starts, is the early phase of pregnancy where folic acid is most important. So it's not prescribing it once the pregnancy is established. As somebody had to look after many mothers who had neurotube defect and anencephaly. That's the important point.
Well, the noble Lord is, may I say, obviously, absolutely right in his observation. I mean, the benefits, including that it contributes, is, for example, to tissue growth during pregnancy, as well as the normal function of the immune system and reducing tiredness and fatigue. And as to the point I made earlier, the very strong reason for this policy, one of them, is the fact that 50% of pregnancies are not planned, and therefore it is about ensuring that folic acid is available in a diet before pregnancy, whether or not that pregnancy is planned. It's absolutely vital.
Can I warmly welcome what the...
We'll hear from the noble Lord Dodds next.
Thank you. May I warmly welcome what the noble Baroness Minister has said, and thank the noble Lord Rooker for his work on this issue, and indeed those who worked with me when I had the honour to co-chair the all-party group on this in the other place. And can she commit, in terms of working in partnership with the devolved governments, to continue that work in terms of implementation through to 2026 and enforcement, so that families will be spared the pain of having babies born with neural tube defects, which is a particular issue in Northern Ireland. So thank you.
I'm very grateful for the comments and the noble Lord, who himself has brought much to this campaign. I'm glad that in Northern Ireland the legislation was actually laid just a few days later on the 20th of November, and I certainly can assure the noble Lord that we will continue to work with the devolved governments on this matter. It's absolutely crucial that we do, and I finish by thanking again all noble lords, including my noble friend Lord Rooker, who has led from the front on this to ensure we can be announcing this today.
Fourth oral question, Lord Seeker.
My Lords, I beg leave to ask the question standing in my name on the order paper.
I thank my noble friend for his question. To deliver 1.5 million homes over this Parliament, the house building sector will need skilled, competent workers, efficient planning and a reliable materials supply chain, as well as certainty for the construction industry. We started on planning immediately and we'll publish the revised national framework tomorrow. We are working with industry to provide high-quality training opportunities and create a more diverse workforce to build the homes the country needs. And the industry also needs access to sufficient quality, safe materials, and we've set a clear direction of growth for the housing sector so suppliers can be confident in increasing their capacity to meet the demand.
I thank the Minister for her reply. My Lords, a target of 1.5 million homes is commendable, but governments actually don't build houses, local councils are disempowered, and private sector simply does not have the capacity. The UK is the world's largest importer of bricks, with about 500 million bricks a year. 30 to 40% of cement is imported, and the construction industry says it needs another 251,000 workers to get anywhere near the house building target. So in addition to the publication tomorrow, can the Minister also publish a detailed report showing how each of the constraints on house building is to be alleviated?
I thank my noble friend. He's right to the extent we recognise the constraints. We spent a lot of time early in government to identify what they were, working with the sector. And while we expect house building activity to double in 4 years, the supply of construction materials would only need to increase by around 20% to meet the demand, as house building only makes up around 20% of the construction sector. So we expect demand for construction products primarily used in housing, like bricks, and the green tech, like PV panels and heat pumps, will increase at a high rate. We see this as a great opportunity for great British innovators to get going and improve the supply chains with us.
My Lords, during the passage of the Environment Act, we introduced the excellent principle of biodiversity net gain. During debate in committee, we voiced concerns over the lack of qualified BNG assessors, both in the private sector and, more importantly, in local government. The Minister, Lord Goldsmith, assured me that the markets would provide. I was sceptical then, I'm sceptical now. Given local government finances, what update can you provide us on the availability of those qualified to assess biodiversity net gain?
We are increasing the support for the planning system, but the specific point around biodiversity net gain assessors, I appreciate, is a different issue. Although we do expect that planning officers will take a role in this, there does need to be that specific increase in BNG assessors. So if I can, I'll reply to the noble lord in writing on that matter.
Further to... Further to one part of Lord Seeker's question, he mentioned a shortage of 125,000 skilled construction workers if the government has hit its target. Modern methods of construction have the potential to help meet that shortage and drive up productivity, but it's had a mixed reception in this country because of a lack of sustained demand. As a large number of the 1.5 million will come from the public sector, can the government use its purchasing power to relaunch modern methods of construction with a sustainable level of demand in order to meet the productivity requirement and give the country the homes it needs?
I'm grateful to the noble lord for giving me the opportunity to. I went to visit a British offsite with Western Homes in Braintree earlier this week. What a fantastic example of British innovation using recycled steel to build MMC products. MMC is an important opportunity to improve the productivity in the construction sector and to quickly deliver the very high quality, energy efficient homes we need and create new and diverse jobs. So we're working to address the strategic barriers to the further uptake of MMC, including the improved supply chain confidence and clarity for warranty and insurance markets and planning reform. And we'll say more about that in the long-term housing strategy next year.
There are currently tens of thousands of Section 106 affordable homes with detailed planning permission waiting to be built out on active sites, but stuck because the registered providers will not take them on due to the current financial capacity within that sector. Minister, will the government, as a short-term emergency measure, consider the use of Homes England grant funding specifically so that registered providers can afford to take up these much-needed affordable homes on these stuck sites?
The noble lady is quite right about the stuck sites, but the government has put, in spite of the very difficult budget round this year, £500 million more into affordable housing. That takes the total for affordable housing up to about £3 billion, and Homes England are working through their programme of how they're going to support the delivery of those affordable homes. I'm sure the support for registered providers will form part of that.
My Lords, would the noble Baroness, the Minister, agree that it would be very unwise to rely on the oligopoly of volume house builders to produce all the homes that we need? Has the time come, and is government now ready to promote the model of the Development Corporation, which buys the land? It's an arm's length body but is controlled by the local authorities, and it then has a master plan and parcels out the sites, yes, to the volume house builders but also to the housing associations, to those building for students, for older people, and the SME builders. Isn't that model now really necessary rather than reliance on those major volume house builders? Yeah.
I'm sure the noble lord is aware of my great passion for development corporations and the way that they work, and it's true to say that we are encouraging Homes England, instead of issuing the great big contracts that they had been doing, to break them down more so that there is more opportunity for smaller developers to take those on. As well as that, we recognise the very challenging conditions that SME house builders have faced to deliver homes in recent times. They're essential to our house building targets. They build out quickly, they train the workforce, and they're embedded in local communities. So we will announce further support for SMEs next year. But this breaking down of the great big development organisations is really key to delivering the homes we need in the places people want them.
My Lords, we agree that more homes need to be built. We all agree that. But with the introduction of the higher local authority house building targets, which will be mandatory, including on so-called ugly parts of the Greenbelt, could the noble Baroness define what ugly means? Is this not entirely subjective, where ugly is not just a grey belt issue, but a completely grey area? Are those living in such areas not going to be left wringing their hands in despair as the bulldozers roll in without genuine protections in place?
There is no intention for bulldozers to roll in without any local say in this. By strengthening the housing targets and allowing development on that poor quality grey belt land, we will get Britain building again. We will set out tomorrow in the National Planning Policy Framework the definitions of grey belt and how we intend to move that forward. But making those housing targets mandatory will reverse the decline that we saw when the targets were cancelled last year.
My Lords, I wonder if the noble Baroness, the Minister, could reassure us that these 1.5 million new homes will be resilient in the face of future climate change. And I'm thinking particularly of the risks of flooding and also the risks of overheating.
I'm working daily on that task at the moment. We're looking at the Future Home Standard with the Future Homes Hub, which involves the whole construction industry, to make sure that we make homes as resilient to climate change as we possibly can. Of course, there is a balance to be struck in terms of delivery of homes, but we want to make sure that we don't end up with a whole generation of homes that need retrofitting in the future. So we will do our best, working with the industry, to make sure that they are as fit for the future as we can possibly make them.
My Lords, I'd like to return to the Labour. I'm sorry. Thank you. I'd like to return to the issue of the impact on the environment of importing building materials. I understand that 500 million bricks, whatever they're used for, has resulted in nearly 300,000 tonnes of carbon emissions. Will the government
consider what role it will play in ensuring that we develop alternatives to building materials being produced in the UK?
I think it's very important that the government supports the development of the supply chain we need in this country in order to enable the building we want to see. And there are, of course, many areas of the supply chain which need to develop. That's why the government has supported the development of an electric arc furnace at Port Talbot so that we can continue to produce steel. And we need to think about the solar panels, the ground source heat pumps, the battery storage. I think these are huge opportunities in our economy which will contribute to the growth the country needs.